Am I a good candidate for a facelift? Are there alternative treatments I should consider? Excellent question. By the time patients come and see me, they've spoken to about 3 or 4 of my staff or my team members, and most of my patients who are good surgical candidates end up speaking to me. Patients that have very little skin laxity, that are not medically cleared or are able to undergo a surgical procedure, for all those patients, we can recommend other non-surgical or other alternatives other than facelift surgery. For all my patients who come and see me for facelift surgery, I do discuss other options. However, by the time you come and see me, you're probably a good candidate for a facelift surgery, and I will discuss that with you during our consultation. What type of facelift technique do you recommend for my specific needs? I think patients can get a little bogged down in the details and minutiae. I think every surgeon out there has their own brand name or technique they claim for their facelifts, but in general, it's a 2-layer surgery. The first layer is tightening muscles. The second layer is removing the extra skin. How those muscles are tightened and which direction you're pulling or lifting, and how are things sutured or sewn back together, and how much skin is taken out and what vector skin is pulled will vary from surgeon to surgeon. So my suggestion is look at before and afters and speak to your surgeon. If you have a preference for a certain technique, which is kind of odd because I'm not sure why a patient would have a preference for a specific technique, but my suggestion is trust your surgeon, trust their before and afters, and trust their expertise by the time you've chosen a surgeon. Can you show me before and after photos of previous patients who have undergone facelift surgery? Yes, yes, yes. So if you follow all my social media profiles, we post our facelift patients daily. I want you to know what you're getting into, so we'll post them in the early healing, we'll post them in late healing. We show their incisions, we show their bruising. We try not to hide anything because we want our patients to be well informed. What kind of anesthesia will be used during the procedure? Are there risks associated with it? So for my patients, we offer 2 kinds of anesthesia. Number 1 is local anesthesia with oral sedation. So that's quote unquote an awake facelift where patients are receiving oral medicines to relax them. So you'll get a combination of some Valium and a Vicodin. So I joke with my patients, I say it's like you've had a couple martinis. We'll sit back in the operating room. Once I put the local anesthesia in your face, you'll be sleepy, but you won't feel any pain. You'll feel some tugging and pulling. So it's similar kind of surgery like when you go to a dentist. When they're working in your mouth, you're not sure what they're doing, but they're working away there. But it's a little more fun because we've given you the Valium and the Vicodin. The other option is IV sedation, where you get an intravenous medication called propofol. It's the same medicine and anesthesia used for patients undergoing a colonoscopy surgery. So those are the 2 options. If you're doing the IV sedation, there'll be an anesthesiologist present. If you're doing it awake with local anesthesia and oral sedation, we don't have an anesthesiologist. In the operating room, I have my operating room nurses and certified surgical technicians. Where will the surgery be performed, and is the facility accredited? Great question. The surgery for my patients are performed in our offices. We have 2 locations. The Long Island office has 2 certified operating rooms. It's accredited by the American Association of Ambulatory Surgery Centers, or Quad ASF, and the New York City office has 1 operating room that's also certified. We undergo rigorous training. We undergo rigorous protocols for inspections, and we follow all of the requirements to get certified. We even have certified personnel in the operating room. So it's very important that you ask your surgeon who's in the operating room with you, because a lot of times they're not certified or real nurses or medical professionals in the operating room. So you got to be careful with that. What is the estimated recovery time, and what should I expect during the healing process? The estimated recovery time is a good 10 to 14 days initially for facelift surgery. So I tell my patients there's an initial healing and a long-term healing. So most of our patients are restaurant ready by about 10 to 14 days, and the full healing will take months and months. And what I mean by that is a little numbness on the side of the face, a few bumps, a little bit of scar care or incision care that needs to happen after 2 weeks.